Warm greetings from Port Harcourt Crystal Lions Club. My name is Lion Ambassador Freki Andrew-Essien, President, Port Harcourt Crystal Lions Club of Lions International. I welcome you to this special video recording in commemoration of World Hepatitis Day 2026. Every year all over the world, the 28th day of July is marked as World Hepatitis Day. As Lions, our motto is we serve. And one of the ways we serve is by bringing to light issues that affect our health and our communities. This year, the World Hepatitis Day theme is Hepatitis. Let's break it down. And that's exactly what we want to do here today. We want to break down myths, break down fear, and break down the silence around hepatitis. To help us do that, we are honored to have three incredible voices to share their expertise. Lion Dr. Nkiru Iweha, Lion Dr. Joy Onoja, and pharmacist Pius Imezwe. They will be answering questions to educate, enlighten, and empower us with the right information about hepatitis prevention, testing, treatment, and hope. So, stay with us. This short video could save a life, maybe even yours. Thank you for watching.
Hello everyone, my name is Dr. Joy Iweha. I'm the Director of Community Health Services at the River State Primary Healthcare Management Board.
My name is Dr. Nkiru Iweha, the Senior Registrar, Department of Pediatrics. I'm also a Lion.
Viral hepatitis is an infection that causes inflammation and swelling of the liver. Now, the liver is one of the very important organs of the body because it helps with food digestion, it helps with excretion, it helps with removal of toxins from the body. It's a very important organ when it comes to fighting infections in the body. So when there is an inflammation or swelling of the liver, it is referred to as hepatitis.
It can occur over a short period of time, where the body fights it and it results over a short period of time, or it can prolong over years and cause chronic illness such as liver cirrhosis and liver cancer. So why is it always described as a silent threat? It is described as a silent threat to human life because most times people can have hepatitis and you don't have any symptoms for a long period of years. With prolonged persistent inflammation over years, they can now develop liver cancer and liver cirrhosis. That's why it's a silent threat, because the body may not present with other signs before it starts manifesting great signs.
Viral hepatitis is referred to as a silent killer because it's one of those diseases that can remain in the human body without causing any harm, without causing any symptoms. So it can remain for years until when the symptoms actually appear, then that is when it's actually serious. That is when it has become something of concern for the individual. So that's why it's referred to as a silent killer.
So what are the risk factors that we can have? Risk factors include use of non-sterile needles for injections, tattoos, or even sharing razor blades. Abuse of substances can also damage the liver. Drinking adulterated water or polluted water can also cause some forms of hepatitis. Having unprotected sex with an infected partner can also cause it, and transmission from mother to child are some of the ways one can get hepatitis. So what are the causes of hepatitis? Judicious irrational use of alcohol can damage the liver. Overuse of some drugs, even our common day-to-day paracetamol, can also damage the liver. Some herbal supplements can damage the liver. There's some autoimmune conditions where the body attacks the liver, seeing it as a foreign body and destroys it. Those are some of the causes that can lead to hepatitis.
Hepatitis is caused by those viruses A to D, and it can also be caused by drugs. There are certain drugs, especially the non-serotype inflammatory agent, some anti-cancer agents, can also be caused by excessive alcohol consumption. There are some main aspects.
So viral hepatitis is caused by different viruses, mainly hepatitis A, B, C, D, and E. And some of the major risk factors include receiving unscreened blood, like blood transfusion from unscreened blood from someone who is a carrier of it. And then for hepatitis A, for have poor handling of food, poor hand hygiene, consuming contaminated food and water. Those are the ones that are mainly hepatitis A. Another set of people that are at risk are health workers who are exposed to patients who may have the virus and they themselves have not protected themselves. So it can also one of the risk factors is also from an infected mother to her child, so through the birthing process. So these are some of the risk factors that are the causes of viral hepatitis. So for you to understand how the virus is spread is like knowing the risk factors. So for instance, hepatitis A can be spread through contaminated food, water, poor sanitation. For hepatitis B and hepatitis C, it's like having unprotected sexual intercourse with an infected person, sharing sharps, needles, razor blades with an infected person, from a mother to her child, receiving blood and blood products from an infected person. That is how you can get, that is how the virus is spread.
So how can we protect ourselves? We can protect ourselves by avoiding contact with an infected person, by having protected sex, maintaining clean environment, and drinking clean water. We're going to talk a little bit about the different types of hepatitis. Hepatitis, there are 5 basic types of hepatitis, but for the purpose of this discussion, we'll just limit ourselves a little bit to A, B, and C. So the first is hepatitis A. This is caused by hepatitis A virus. It is spread by use of dirty water, contaminated water, and from even water that has been contaminated with infected feces. And if one has poor hygiene, that's a short period of infection and can resolve on its own after a short time. The body can fight it. Good thing is there's also vaccine for protection and prevention.
The difference between the 3 hepatitis A, B, and C is that A always occurs as an acute condition and it can resolve on its own without medical treatment.
Hepatitis B and C are of some concern because they are spread. Those are the ones that are spread through body fluids. So when you have unprotected sex, through the mother to the child, when you share the sharp needles, it does not, and they do not resolve on their own. If the patient is infected with hepatitis B or C, it will not resolve. It is usually a chronic disease. Those ones are, those are the ones that are the silent killer.
Hepatitis B is caused by hepatitis B virus. It can be passed from spread by contact with an infected person, by mother to child, and by use of infected blood. More chronic forms can lead to liver cirrhosis and liver cancer. It has a vaccine for prevention, but there's no cure for it, but there are drugs for its treatment. Hepatitis C is caused by hepatitis C virus. It can be spread by contact with an infected person and even by needle sharing. It can also become chronic. There is vaccine available for this type of hepatitis, and this type of hepatitis can actually be cured over 8 to 12 weeks.
So hepatitis A can resolve on its own with supportive treatment and care. Hepatitis B should be prevented, can be prevented. It's not always cured. is not always cured, but effective medicine can control the virus and, of course, prevent the patient from spiraling into liver cirrhosis and severe complications. Hepatitis C, with the aid of antiviral therapies, can be managed.
Can I advise that we do routine checks, especially if you're age 40 to 60 and above, which is the peak period for infestation with hepatitis virus. It's important to always assess ourselves medically. There are some hepatitis centers we can assess. Also, can be handled in various medical centers, hospitals, and clinics. The government is doing a lot to make sure that people with hepatitis are properly managed or cured.
Let us vaccinate our children. These vaccinations can be gotten in the primary healthcare facilities in River State. And I know some private hospitals that can offer the service as well. As with any virus that causes cancers and lead to cancers, for instance, the human papilloma virus, early detection is key. You can get yourself tested and you can get yourself treated from these viruses. So in the case of hepatitis, viral hepatitis, please get yourself tested and seek proper medical advice from healthcare professionals who are licensed and who have the expertise in the field of management of these chronic diseases. Thank you.
So to crown it all, live a healthy and safe life. Avoid anything that can cause hepatitis to all. Thank you.
Wow. Thank you for staying with us through this awareness session. And a big thank you to our speakers for sharing from their wealth of knowledge and experience with us today. Thank you so much. Now, as we commemorate the World Hepatitis Day, remember this: hepatitis is preventable, treatable, and with the right information, it is beatable. So here's our call to action. Get tested, know your status, speak up, and share this video. I remain Lion Ambassador Andrew-Essien, and this is a message from Harcourt Crystal Lions Club, Lions Club International. In Lionism, we serve. Thank you.